was freezing cold outside and I was dressed in all the warm clothes that I could possibly find. I was lying on the floor of a bombed-out hospital in Beirut in Lebanon. I'd left the United Nations following the massacre of 2,000 women and children in that camp. I was a 33-year-old nurse and I continued to stay in the camp and work there with the Palestinian nurses. And I was dealing with many shattered people as well as nurses. There was a lot of emergency assistance which flows into a situation like that, but it was very obvious that the shattered health workers needed help to re-establish their working lives. At the time, I was working with Norwegian solidarity workers, and I was really impressed by the way that they were working with the Palestinians in a really lovely sense of solidarity with them. And I thought, well, Australian workers should be doing some of that. I was inspired by those workers, just the notion of their solidarity. I came back to Australia, did some talking around, and eventually met with Cliff Dolan, the president of the ACTU. He liked the idea and he took it to the ACTU executive, and they approved it towards the end of 1983. In January 1984, we had our first board meeting. Soon after, with the help of Australian trade unions and nurses, we were able to start our first training program with Palestinian nurses. APHEDA's work skills training programs were up and running.